So this is the heart, and we'll do the electrical part first. So this is the sinoatrial node. This is the atrioventricular node. Then the bundle of His, or AV bundle. And then there's the right bundle branch, left bundle branch, and Purkinje fibers. I have it on here too. You can't see the SA node and AV node, but you can see the bundle, right bundle branch, the left bundle branch, and the Purkinje fibers there. Okay. On here for the coronary arteries. Actually, I'll do that on a different video. Okay. So, right atrium, right ventricle, left atrium, left ventricle. Interventricular septum, interatrial septum. Here, if this were a fetal heart, this would be the foramen ovale. But this is an adult heart, so it's closed over now, and so this is the fossa ovalis. Over here, if this were a fetal heart, this would be the ductus arteriosus. And so now that this is an adult heart, this is ligamentum arteriosum. The blood vessels for the heart are superior vena cava. Remember, that comes from the left brachiocephalic vein and the right brachiocephalic vein, superior vena cava. This one down here is the inferior vena cava, but you remember now from the other model that it's much longer. It comes all the way from the legs. So, superior vena cava, ascending aorta, aortic arch, descending aorta. This is the brachiocephalic trunk or artery, left common carotid artery, left subclavian artery. And then this would be the thoracic aorta here. This is the pulmonary trunk, and it's split into the left pulmonary artery, and then behind, I'm going to rotate this behind, is the right pulmonary arteries. And remember, those are the blue ones. This is right pulmonary veins. How do you know that it's right? Because it's right next to the superior vena cava, which always goes to the right atrium. And on this side is the left pulmonary veins, and that's where the aorta arches to. So that's how you remember that's the left. While we're here anyway, you might as well look in the respiratory. This is the trachea with the tracheal cartilage. And then this is the carina over here. And then it splits. Remember, this is the back of the heart now. So this would be the left primary bronchus and the right primary bronchus, because we're looking from the back. When you have a chance, also review trachealis muscle. Right here, it's the back of the trachea, known as trachealis muscle. Okay, so you have, these are the tricuspid valve, bicuspid valve, also known as mitral valve. These two atrioventricular valves are between the atrium and the ventricle, hence the name. These stringy things are chordae tendineae. These things are called papillary muscles. This stuff here is trabeculae carneae. Remember, the trabecula are like bridges, as in spongy bone. The layers of the heart. Epicardium, which is also the visceral layer of the pericardium. This is the myocardium, and then the endocardium would be on the inner layer, covering the trabeculae carneae. The two other valves are semilunar valves, the aortic valve and the pulmonary or pulmonic valve. So this would be, the pulmonic valve will go to the pulmonary trunk, and the aortic valve goes to the aorta. Right above the aortic valve are the openings to the coronary arteries. This would be for the right coronary artery, and that would be for the left coronary artery. Eventually, the blood is going to go through all the coronary arteries, supplying the epicardium and the myocardium with oxygenated blood, will come back through the cardiac veins to the back of the heart, coronary sinus, and then dump back into the right atrium right here. Okay, so remember that the superior vena cava, the inferior vena cava, and the coronary sinus all dump into the right atrium, whereas the left and the right pulmonary veins dump into the left atrium.